Well, welcome everyone to the Nation of Lifesavers webinar this morning. Lack of CPR training and resources is a health equity issue. And so to address this inequity, the American Heart Association is committed to every household having at least one person who knows CPR or hands-only CPR through an initiative entitled Nation of Lifesavers. To learn more about the need for CPR knowledge and training in Rhode Island, we have a panel, CPR champions, to share the importance of why increasing a nation of lifesavers in Southern New England is important and how you can become involved in this effort. I'm going to turn this over and have our panelists. We'll begin with John Potman, and then we will move to Rodney and then to Tim.
Good morning, everyone. My name is John Potvin. I am a captain with the East Providence Fire Department, where I serve as the Director of Emergency Medical Services, and I am also the chairperson of the Southern New England Board of Directors of the American Heart Association.
Good afternoon, everyone. My name is Rodney Chapman. I'm the Vice President for Public Safety and Emergency Management at Brown University. That role also serves as Chief of Police, and a pleasure to see and meet and interact with all of you.
Good morning, everyone. My name is Tim Draper. I'm the Senior Vice President of PR and Community Engagement for Navigant Credit Union. As part of my role, I'm also the Secretary of the Board for the Navigant Credit Union Charitable Foundation. It's a philanthropic organization that's part of the credit union, and it's been up and running for about 5 years now.
Well, welcome. And I just want to begin with, we're going to open up now and have a few questions for you. And I'm going to begin with John. And just pose the question, why do you think learning hands-only CPR is so important?
Thank you, Albert. So there are about 350,000 out-of-hospital cardiac arrests that occur annually. So that equates to about 1,000 cardiac arrests a day across our country. And of that, 90% of those people that suffer an out-of-hospital cardiac arrest die. So if we can train more people to learn CPR, we can save more lives. So if somebody receives early CPR, you could double or triple a cardiac arrest victim's chances of survival. And, interestingly, despite the fact that that statistic, can really help save a life, it seems like about 7 out of 10 Americans feel that they feel powerless in the face of a cardiac emergency. So they feel like they just don't know what to do and don't feel prepared to help out to save a life.
And so, Rodney, I'm going to turn it to you and ask the question, can you tell me a little bit about your past experience with the American Heart Association, the CPR kiosk, and maybe talk a little bit about that kiosk?
My first police chief job was at the University of Dayton, and I started there in 2016. And a few months prior to my arrival, one of our students, Sean Ferguson, was walking across the parking lot by the recreation center and was struck by lightning. And to John's point, many of the people who were present felt powerless to help. By a good stroke of fortune, there was another student there, Matt Lickenbrock, and 2 days prior to this event, he was in the Dallas-Fort Worth airport, where there was a CPR kiosk there, and he taught himself CPR just 2 days prior to that event. And he was there at the scene, and all of the medical first responders do credit his immediate CPR intervention as saving the student's life. And so fast forwarding to when I arrived as a chief, shortly afterwards, the University of Dayton received a CPR kiosk for the campus. And I had an opportunity to meet both Matt and Sean, and I told them if I ever left the University of Dayton to go to another campus, that I was going to champion the cause of teaching as many people about CPR as I can, and would certainly advocate to whatever campus that would be to have a CPR kiosk as well. And those are the conversations I'm having now at Brown University.
So, Tim, why is increasing a nation of lifesavers here in the Southern New England so important to you and Navigant Credit Union and your grant support for this effort?
Well, Albert, I think it starts with, what our mission is at the foundation, which is to improve the well-being of our families, businesses, and communities throughout Rhode Island. And I think it'd be hard pressed really to find anybody who hasn't somehow been impacted by heart disease. And it can happen anywhere, anytime. It's a friend, it's a relative. Quite honestly, I have a history in my family. My doctor monitors me for that every year, and so I want to make sure that if something should happen to me or somebody in my family or a friend of mine, that somebody around them would be able to assist through either through CPR or the ability to use an AED or anything in between. And it's really that reality, that our support can really kind of strengthen the initiative here in Rhode Island, which is what we've done with our grant last year, and hopefully give an opportunity for people to have a fighting chance should something happen to them in a random moment of time. We've been trained here at the credit union. All of our staff have the opportunity annually from the Smithfield Fire Department to take CPR courses so that we're all up to date. I know I'm probably due for an update myself, but I think that we all take this very seriously here at the credit union. And I can tell you that all 25 of our branches have AEDs in them. Our corporate operations center has 3, I believe. And then our corporate center has a few around the building as well. So we've made the investment internally in these hardware, these pieces of equipment, and the training to use them. And so we want to make sure that we're doing our part in helping that training find its way into the community as well. And the grant also included, I think, some hardware costs built into that as well. So housing AEDs in certain locations and then giving the folks in those locations the training that they need.
John, so how can others, in the community become involved? What can they do to be more involved in this?
Yeah, so I think that's a great question, Albert. And as Tim said, and then Rodney, his story that he tells about that campus, and the fact that that student had learned CPR just the day before, right, is very impactful. Only about half the people that need CPR actually get it in the field. Again, because people are just feel like they're ill prepared to help out, and we know that about 70% of cardiac arrests happen outside of the hospital. So that means, they're occurring in our places of business, our places of worship, and in our home. So if somebody needs CPR, or if you are called upon to perform CPR, most likely it's going to be on somebody that you love or that you know. And clearly we know that women tend to receive less CPR than men. So, that's another important thing to note, that, people feel like there's going to be repercussions, so they are sometimes hesitant to perform CPR on a woman. So really, I think what we're hoping for is we're asking people to get involved, right? We don't want them to be a bystander. We want them to become empowered and to become a lifesaver rather than a bystander. So, some of the things that you could do to get involved on from an easy standpoint is take 90 seconds of your day and learn hands-only CPR, which it could be just as simple as, going to heart.org /hands-only CPR, watching a quick video. It takes 90 seconds. You could practice pushing on a basketball, or, you certainly could take a full CPR class. But most importantly is just to commit to get involved, to say, you know what, if I see somebody suddenly collapse, I'm going to be committed to do something. Knowing the signs and symptoms of cardiac arrest and when to perform CPR, right? So sometimes people get confused between the difference between a heart attack and cardiac arrest. But when somebody's in cardiac arrest, they're unresponsive, they're not breathing, and their heart is not beating. So if you see somebody suddenly collapse, we want you to call 911 and push hard and fast in the center of their chest. It's those 2 easy steps. If you want to get a little bit more advanced, you can learn the difference between the signs and symptoms of a heart attack and cardiac arrest. And then also you could learn the locations of AEDs. And certainly if you're a business owner or involved with an organization, you can make sure that your people are trained in CPR and possibly have an AED at your facility.
Rodney, so What is your role at Brown University, and why do you believe bringing a CPR kiosk like the one at other locations is so important?
My role at Brown is all things safety, and I take a very comprehensive look at that. So that is physical safety in terms of prevention of crime, but it's emotional and mental health safety as well, but just a comprehensive way in which we can be more in community with one another. And what excites me about this conversation that we're having, I'm learning tools to communicate to people how accessible these skills are. I mean, you just gave me something, John, with that 90 seconds in the basketball was fantastic to have. But what really excites me even more as I think about my role at Brown specifically, it's just Brown, we have more than 10,000 students at Brown. And our students represent every state in the union. They represent over 100 different nations. 72 different languages are spoken on our campus. And to think that we can bring something that is a fun and interactive way for them to learn how to save someone's life. And then with the turnover that we have, we know that these 25%, generally speaking, of our population will go on to other places and another 25% will come in. It's just thinking if we had a resource like that, just think of the number of people that are out there equipped with this skill that can save a life. It's just exciting to even contemplate.
And then lastly, for Tim, support of this initiative is vital. And so what is your message to others to stand with you in this effort around our nation of lifesavers?
You know, from a community impact perspective, we take very seriously our role in the communities around our institution. We are the beneficiaries of the direct contact that we have with people in the community, right? So we're a credit union, we're owned by our members. We don't have investors from overseas or around the country. It's literally people in our backyard. So as an organization that has that kind of direct impact to the community, and we are fortunate to be in a position where we can actually help in a lot of ways. From what we just did in the grant was financial, right? So we were able to give money to provide all these types of services and trainings. But you don't have to have money to be a participant in any of these programs. If you've got space in your building, in your offices, that you can dedicate a few hours to after work and call John or anybody from the Heart Association to come in and do your CPR training, you're participating and you're helping. It may not be from a financial standpoint, but it's from an action standpoint. You've got space. We're going to give it to the community to come in and do work in there and broaden the reach of these trainings. It could be using your social media channels to inform people that this type of activity is going on. I get a training going on at the local, senior center, and we're just helping drive people to the senior center. So there's lots of ways an organization above and beyond the direct funding can assist. And again, I've participated in the Heart Walks, I've participated at the Heart Balls and all the other things that the American Heart Association does. So I'm very aware of the level of support people have, kind of throughout the community. But it's not a matter of can you, it's a matter of will you. And so I am challenging everybody out there who's listening, who is in a position to support and help out in one way or another, to do it. Find a way to do it and do it. It's not hard, and it's certainly not expensive.
Well, thank you all, gentlemen, for just a really great discussion. And, I'm empowered, encouraged, because as I'm out there in the community and I see the need for hands-only CPR to begin and then CPR, this really affirms what this is all about and how vitally important it is, for our community to learn this just to save another life. And so I just want to thank you for your time this morning.
Likewise. Thank you all.
Sounds great.
Great
Thank
weekend.
you.
Thank you.